Hi, I'm Catherine Connors, and I'm a physical therapist at UT Southwestern Medical Center. On behalf of my colleagues and myself, I'd like to present our manuscript titled Implementing Standard Physical Therapy Guidelines with Patients Acutely After Single or Bilateral Lung Transplant, a quality improvement project in the hospital setting. This project was initiated after we noticed a variation in physical therapy intervention among our hospital's physical therapists working with lung transplant recipients. My colleagues and I wondered if standardizing physical therapy at our hospital could improve lung transplant recipients' physical function, measured by 6-minute walk distance and 30-second chair stand test performance. When we looked at the literature for guidance in standardizing physical therapy with our lung transplant recipients at our hospital, we found general recommendations in the hospital setting or guidelines regarding physical therapy with stable patients in the outpatient setting. As a result, my colleagues and I created physical therapy guidelines for this project. The guidelines consisted of gait training, power and strength exercises, timed endurance activities, tailored home exercise programs, and functional outcome measure use, including the 6-minute walk test, 30-second chair stand test, and the activity measure for post-acute care. We implemented the guidelines with all individuals who underwent single or bilateral lung transplant after March 8, 2021 at our medical center. We compared the standardized physical therapy guidelines group to a baseline group of lung transplant recipients who participated in outpatient physical therapy between July 2019 and July 2020. The baseline group of recipients participated in traditional physical therapy, which at our hospital included inconsistent interventions, including activities of daily living, strength exercises, and ambulation to promote functional endurance. There was also inconsistent use of functional outcome measures. For recipients in both groups, initial evaluation occurred in the ICU, and following that, all recipients in both groups participated in physical therapy 5 to 6 days per week. No recipients were excluded from either group. Following discharge to the home setting, all lung transplant recipients in each group participated in outpatient physical therapy at our medical center's pulmonary clinic. During initial evaluation, 6-minute walk distance and 30-second chair stand test were assessed. The baseline group consisted of 19 lung transplant recipients, and the intervention group included 25. Most patient characteristics, including age, pre-transplant diagnosis, ICU length of stay, and hospital length of stay were similar between the groups. We found that the mean 6-minute walk distance for the baseline group was 884 feet, and the intervention group demonstrated a statistically significant difference of a mean of 1,054 feet. The baseline group demonstrated a mean of 4 repetitions with the 30-second chair stand test, and the intervention group demonstrated a mean of 7 repetitions. Following this project, we adopted the physical therapy guidelines we created as the standard of care at our hospital. Although we found that the guidelines benefited the intervention group discussed in the manuscript, the guidelines serve as merely an initial step in identifying optimal physical therapy interventions for lung transplant recipients in the hospital setting, and limited conclusions can be made at this time. Thank you for reading the manuscript. Please reach out via the email address included in the manuscript if you have any questions.